Let's talk about renin. Renin is the first component of the renin-angiotensin aldosterone system. It converts angiotensinogen to angiotensin 1. Renin secreted from the kidneys. This is an enzyme clears the angiotensinogen to angiotensin 1. This is the first enzyme in that RAAS. It released from juxtaglomerular apparatus in the kidneys. In kidney, the functional unit is called nephrons. Nephron has blood supply through the afferent arteriole to form glomerulus to filter the blood. You remember the nephron has nephron capsule or Bowman's capsule. If you look at the enlarged view, afferent arteriole brings blood into the Bowman's capsule and form bundle of capillaries called tuft of capillaries called glomerulus. Juxtaglomerular apparatus is next to the glomerulus. Next to. Juxtaglomerular. Next to the glomerulus, there is an apparatus formed from two different types of cells, mainly juxtaglomerular cells and macula densa cells. Let's talk about juxtaglomerular cells. These are the cells secreting the renin. So, afferent arteriole has specialized smooth muscle cells. These are large, stretchable, granulated cells which secretes renin. Associated with that, there is specialized tightly packed, densely packed cells called macula densa. These are formed from the distal convoluted tubule. Together, juxtaglomerular cells and macula densa form juxtaglomerular apparatus for regulating the blood volume. And if you get specific question, which cells secrete renin? Juxtaglomerular cells of the afferent arterial system producing renin. They are also called JG cells. If you look at an enlarged view, you can see this capillary, these smooth muscles with the enlarged and stretchable structures with a lot of granules there. Why? The reason is they synthesize, store and release renin. Renin is activated only whenever necessary. So, three important points to remember from this slide, that is renin secreting during low blood pressure. For example, reduction in the circulating blood volume triggers the stretch sensitive JG cells to secrete renin. And second, this mechanism is reinforced by the decrease in the sodium, that is reduction in the sodium chloride concentration in the distal convoluted tubule also cause the stimulation or the stimulus chemoreceptor stimulation, which will cause the secretion of renin. And if you look at an enlarged view, you can see the distal convoluted tubule. Low sodium stimulate this macula densa cell. They will give signal to the JG cells to secrete renin. And the third condition, by sympathetic nervous system activation. At times, increased sympathetic discharge will stimulate the renin secretion. For example, when during fight or flight situation, for example, if you wanted to run away from a situation or if you have to fight, you need to supply a lot of blood to the brain and skeletal muscles, then also have to supply blood to the heart. That's the reason you need higher blood pressure. Therefore, sympathetic activation, beta adrenergic signals will increase the secretion of renin. Okay, 3 points to remember from this slide. Then, dysregulation of the renin also can cause some pathophysiological condition. For example, out of all the hypertensive patients, about 15% of the condition is because of the high renin hypertension. During pharmacology, you will learn 5 classes of drugs for regulating the blood pressure and cardiovascular protection. For example, these are called renin, angiotensin, aldosterone system inhibitors. First one is direct renin inhibitors. That's the one more point we can explain in this section. Renin inhibitors, they are targeting the renin, so they block the synthesis of all the angiotensin peptides because it blocking the function. Example of the drug, aliskiren. So this drug's mechanism, this blocks the catalytic activity of the renin. If I explain in a simplest explanation, if I consider renin as an axe to chop or cleave the long angiotensinogen peptide into a decapeptide angiotensin 1, I'm using this renin. But if I use the aliskiren, I'm going to block the catalytic activity so that I will not cleave the angiotensinogen. Inactive precursor of the renin is called prorenin. This is one more point to remember. Prorenin is a proenzyme. This is like if I consider as an axe, whenever necessary I will take it out. That means inactive form, it will be protected in a box. But active form, renin will be used, or the conversion of prorenin to renin will be with the help of different enzymes, and both renin and prorenin are stored in the Jj cells also. And yeah, I hope this helps.